Hey Tanya, thanks for your reply, and just wanted to do a special video message to you, and then have everybody else look at it too, because I think the question and the statement that you made is very fundamental to you guys that are just now learning how to do therapy. And it's about therapy models. Now, I know that we probably put a lot of emphasis on that, and to be real honest, I think sometimes it can be overwhelming for you guys that are just getting your sea legs and trying to learn. First of all, you got to learn the fundamentals of what the models are all about, and get to know them. And we throw so many at you so quickly that it's really unfair. But that's the way it is for online graduate school. You don't get that extra coaching that you might get from a brick and mortar university of going in and talking to your professor about specific things, and depending on what type of supervision you're eventually going to get in your practicum and internship, is kind of, it feels like you're out there on your own. So I want to give this special video message about therapy models, and just let me talk for a little bit. Don't have anything prepared, just talking off of the top of my head. First of all, you are the most important element in the counseling session as far as the involvement from the therapist side. They did research to find out what was the most effective elements in a successful therapy, and they found out that the most number one critical element is the client. Okay, of course, the client is the most important single element in the entire process of counseling. The second is the client's environment. Who the client hangs out with, what their environment is, what their situation is the number two element, the most important element in success of therapy. Number three is the relationship with you, the therapist. That's the most important element that you bring to a counseling relationships and successful counseling is you. So that's why I have these little sayings. I have all these bishopisms. One of them is I don't teach therapy, I train therapists. Because you, the therapist, are the most important element as far as outside of the client's control of success. Now, the last two, I think, has to do with the universal view of the therapist model, and then individual techniques. So, the model doesn't even come into practice with your client until the fourth element. So that's why I wanted to point that out, that you are the most important thing. Now, what's the purpose of a model? So, to me, the purpose of a model is just to keep me organized. I need to have some type of organized thought process of what's going on. So I'm looking for that organization. Now, therapy is an art and a science. Okay, the science is what you've been doing so far. It's been about reading, about listening to authors, about watching other people do therapy, about reading about the assumptions are behind all these different therapy models. That's the science part. But the art part comes in because we have to juggle three things at once. First of all, we have to maintain the relationship with the client. And to me, that's the first thing that you need to get, and the most important element I want you to walk away from your degree with, is being able to join with a client and to become part of their world, and to be useful for them, to gain trust, and to have a relationship between you and the client. That's the most important thing. And that's what we want you to work on. Hopefully you did that in track one. And you developed your skills, your listening skills. It's what I say, the first thing you do is be Carl Rogers. You do all those seven elements of creating rapport. Now, we call it joining because we're a systemic group, so we join with a system. The counselors build rapport with a client. So we become part of their system. So the first thing is connection with the client. You have to do these three things. The second thing you have to do at the same time, while maintaining a relationship with the client, is that you have to kind of understand what's going on in a second order level. We talk in family systems about first order change and second order change. First order change, give a man a fish, you feed him for a day. second order change, teach a man to fish, and you feed him for a lifetime. So we're looking for second order change. What's going on underneath the sea level of the iceberg? We see the tip, okay? That's what everybody sees. They see symptoms, okay? But as systemic therapists, what's going on underneath? What's happening? Is there individual psychology going on? Well, of course there is, but it's the combination of that individual psychology with the individual psychologies going on with all the people and institutions around them. So maintain rapport and connection with the client. Number two is understand what's going on under the surface. And that's kind of where your model comes in. I mean, what's going on with this person? What's going on with this family? Well, if you're CBT, you're thinking, they've got incorrect information. They're having incorrect thoughts, and we need to straighten their thoughts out and give them correct thoughts. But if you're looking at something else from a systemic perspective, you're thinking that the relationship, the connections that they have, the relational factors, is what's messing people up. If you're solution focused, what you're looking at underneath there is that they're really focused on the problem. And we don't really care about the problem. We just want to go and create the solution. The problem doesn't have anything to do with it. It's all about creating the solution. So getting their focus on the solution versus off the problem. If you're Bowenian, of course you're talking about differentiation. There's a difficulty there in differentiation. You're out in the middle of a triangle. You can't get loose. And those are the things that they're creating the symptoms. So understanding what's going on in a second order change, second level change, is about how you're viewing the system. What is your assumptions? Every therapist from a different model is going to see different things. What are you going to see? Well, you're going to see what you're trained to see. Play a little game, if you would. Right now, look around your room that you're in. My office. So look around your room, and I want you to see everything in your office that's red. Go. 1, 2, 3, 4, stop. Close your eyes. Now, this is a familiar place to you, but I want you to remember what you saw. So now think of everything in the room that's blue. Wait, you said to notice things are red. Yeah, because the things that you are noticing is what you're going to remember. There are red and blue things in there, but the thing you focus on is what you remember. So that's the same thing that we do in therapy. What you focus on with your client is what you're going to be working with. So are you working with thoughts? Are you working with just straight emotions? Are you working with neurobiology that you're going to use drugs? Are you working on relational issues? Are you focusing on the solution? What are you looking at? So all your model does is keep you organized. So maintain connection with the client. Number two is understand what's going on underneath the surface at the second order level. And number three, you've got to figure out some type of way to intervene into the system. Throw a monkey wrench into whatever is happening right now. That's why I like systemic therapy. It's all about some type of patterns, relational patterns, communication patterns, behavioral patterns. It's all about patterns. And I think my job as a family therapist is to take a monkey wrench and throw it into the works and make it all just, we're going to disrupt that pattern. Because I have a confidence in the family and the couple that they can reorganize around a healthier pattern than the one that they're having. So maintain a connection with the client, understand what's happening at a second order level, and then figuring out a way to intervene. Those three things, once you get that down, then you can apply that to any model that you want to. Now, in our program, we really want you to concentrate on family systems. That's what our program is about. Now this is Bishop talking, and I think it's the best way to learn, and there can be a debate about this. But I think you should choose one model, stick with it, and learn the dang thing, okay? Read articles, stick with it. Don't try to learn 8 of them at a time. You're kind of past that right now, guys. Y'all have had the summary courses, okay? Y'all have looked, and you've had things that have kind of drawn to you. So pick a systemic family therapy model and just stick with it and learn it. And use that to organize yourself as you learn to be a therapist. Okay, how do you build connection? How do you join a system according to your model? And how do you use your own personality in with that? See, I think that's an important thing. I don't want people to come into track two and put on the therapy hat and pretend to be a therapist. Okay, I've given the instructions many times to people: quit playing therapist. I don't want you to play therapist. I want you to be you. So Dana, I want you to be you. Tanya, I want you to be you. Jenny, I want you to be you. I want everybody to be themselves, using a systemic therapy model to keep themselves organized. Now, if you go off and you want to use another model later on, that's great. There is no model that's any better than the other. Okay, there is no evidence. We haven't had any research that shows that one model is better than another model. We've had research that says, well, this model is effective with this diagnosis, and this is effective with this set of symptoms. But there's no research to show that one of them is better than the other. The important element is that what do you believe? So when and what brought all this on, Tanya, was I hear this a whole lot, and thank you for bringing it up, is when I hear, well, I want to be flexible. And you need to be flexible. I mean, because you never know what's going to walk through that door. But you need to walk into the room knowing who you are. You need to walk in and knowing what kind of therapist you are when you're actually seeing a client. Because if you're not organized, how do you expect your client to get organized? So when you walk in, you know what? I'm a Bowenian therapist. I'm a solution-focused therapy. I'm an MRI therapist. You have that identity with yourself, and you have that way of organizing so that, guess what? Everything that you hear is going to be filtered through that model. Now, if you walk in as a blank slate and you start listening, what do you think you're going to hear if you're a blank slate? Well, you answer the question. You can't. You can't walk in as a blank slate. You're going to have some type of bias. You're going to have some type of way to view the system and make that. You're not psychoanalysts. You know, psychoanalysts claim that they listen as a blank slate. They just listen, and what happens happens. No, that's not what we do, because we do have a bias. So I think a lot of times if we say, all right, we're going to look at one model, and we're going to get good at it. Okay, we're going to learn it. We're going to learn how to do it with a variety of different symptoms, with a variety of different issues. Then we're going to learn how to be therapists. So I think sometimes when we talk about, well, it seems like that when I use this model with this client, it works better than with this one. Now, you guys don't have any experience with that yet. Okay, you just practice in track one, and you'll get more experience when you start doing your practicum and internship and actually seeing live people instead of your classmates. But I think when we see that, we'll listen to them from a certain set of lenses, and then we'll be listening to that. Because again, I don't think you can be biased. If I hear that, okay, well, I think this model is better with this particular type of client, and this model is better with this particular client, I think what you're really saying is that I, as a therapist, are more comfortable working with this model with this kind of client, rather than this model works better with this type of client. Does that make sense? I'm not comfortable enough with my model to be able to use it with this set of clients, so I'm going to run to something that feels better, that for me makes a lot of sense. What that tells me is that, okay, you're still learning, so taking a solution focused approach when you walk through the door and someone's dealing with an anxiety, you might think, oh, well, wait a minute, anxiety is best done by CBT, so I'm going to switch and start finding out their irrational thoughts. Well, that's how a CBT therapist would do it, but also that's what you saw when you walked in. What do you see when you walk in will depend on your organization. It'll depend on your model, not just model of therapy, but model of the world. Why does pathology happen? Have you thought about that? And then how does change occurs? When you answer those two questions, you kind of fall into the model that you're going to be using. Okay? Well, symptoms happen because the neurochemistry is messed up in the brain, and we need to add something else to it. Well, you're talking to a psychiatrist now. You're talking about someone who's into neurobiology, and their tools, how they view the world, is through symptoms and medicine. So they're going to automatically go to the medicine. Not very often you go to a psychiatrist and you don't walk out with a script, right? So that's how they see the problem. So if you're a CBT person, every person you see, regardless of the symptom, you're going to see faulty thinking, right? Okay. If you're an EFT therapist, you're going to see a disconnection between relationships on an emotional type of level. Everybody. You know, if you're a Bohemian, you're going to see disruption in hierarchy. You're going to see differentiation of self not very, very well. Every client you see. Okay? So, that's my little speech on therapy models. And I like to give this speech when I do track 1 or track 2 when I'm there. I'm probably not going to catch you guys because I'm a part-time Capella faculty now. But we go through this at Texas Wesleyan University when we go through our pre-practicum, which is what this course is for you guys, and then our practicum and internships. Is talking about how do you discover that model and what's right for you. And guys, it's hard. Don't expect this to be easy. If you have a natural attraction to something, go with it. That's kind of really nice. For us in our program, it's a systemic. For me, solution focus makes sense, but I've changed. I've added something that makes sense to working with couples. I'm now using restoration therapy from Terry Hargrave out in California. Restoration therapy makes a lot of sense. It combines a lot of psychodynamic type of things, multi-generational elements, and relational systemic type of things. He calls it's kind of like psychodynamic therapy wrapped in systemic clothing. Well, man, that's just right up my alley. When I got introduced to that, bang, I went for it. And it just felt really good. So it's good to explore. It's good to go to workshops. It's good to learn different stuff. If it makes sense to you and feels right, go with it and stick with it and learn it. You guys don't know it yet, okay? I tell my interns when they come in, one of the things they need to remember, another bishopism, is, guys, you suck as therapists. Yeah, you do. Now, if I suck as a therapist after 25 or 30 years of experience, there's a problem. You guys are supposed to suck at therapists because you don't know how to do it yet. That's what you're doing now. You're learning how to do it. So, find your model. If you don't know, just pick one that feels right and stick with it and learn it. And then later on, if you want to change it, change it. But you can still apply those 3 elements that you learned to any therapy model that you choose after that. Okay, enough of my ranting. I hope that's useful. Tanya, thank you again for bringing this up. I really appreciate you answering that response and giving a response back to me. Please, guys, if you have a question about that, let me know. I'll be glad to talk with you more about it. But I get jazzed up about this because this is you. This is your profession. This is using who you are for the rest of your life. So you got some flexibility there, but learn it first.